Hi everyone and welcome to today's class. My name is Raphael. I'm an expert on psychopharmacology. In today's class, I'll be talking about another class of antidepressant called serotonin-norepinephrine reuptake inhibitors. Serotonin norepinephrine. Now, this class of medication has two neurotransmitters involved. The neurotransmitters are serotonin and norepinephrine. Those who are with me in my previous class, when we were looking at the first line of medications for antidepressant, the SSRI, only one neurotransmitter is involved in the SSRIs. And in that case, it is serotonin. In this class of antidepressant, there are two neurotransmitters, serotonin and norepinephrine. So, how does the presence of norepinephrine impact treatment? Before we come to that, I'll give you examples of serotonin norepinephrine reuptake inhibitor medications. In this case, I'll only look at the two medications that are common. The other medications are expensive and they have more advanced reactions and they are rarely used. So the most common serotonin norepinephrine reuptake inhibitor medications, we're calling them SNRIs, are one, venlafaxine, and two, we have duloxetine. And as I said, it's important that you get to know both the generic name and the brand name. So the generic name for this is venlafaxine. The brand name is Effexor. And this is Cymbalta. So let's look at this first one, the first SNRI. We are calling it venlafaxine. Venlafaxine. Now, when this medication first came out, when venlafaxine first came out, there was a lot of excitement that the dual effect of this medication would be effective in the treatment of depression. So, back to our question, how does the presence of norepinephrine impact treatment? So, and that's why when this venlafaxine came out, providers were excited, all the stakeholders were excited. They said, well, we're going to kill this because they thought the dual effect would be effective. But for venlafaxine, despite all the hype, it has become increasingly clear that venlafaxine is more similar to an SSRI. It's more similar to an SSRI than it's different. In fact, low doses, low or moderate dose of Effexor. Effexor now the venlafaxine. In fact, low to moderate dose of the Effexor is basically an SSRI. So as a provider, why would you want to go for venlafaxine when you have SSRI that are first choice? Well, maybe if your patient is not responding well to the SSRI, as I said, you may want to switch to another class of medication. But we are saying that at this point, venlafaxine, when you give in low or medium dose, it's basically an SSRI. With the norepinephrine, the norepinephrine transporters are only open at higher doses. So you can only have that dual mechanism of venlafaxine if you are giving it at higher dose. That's when the norepinephrine transporters will be active. So the key point here is that in low doses, venlafaxine is the same as an SSRI, because at that point, at low doses, the norepinephrine transporters are not active. They are only active. The norepinephrine transporters are only active at higher doses. Now, having said that, you will realize that venlafaxine has actually differentiated itself by introducing a new side effect. So, hypertension. Thus, this is high yield hypertension. So, high dose. So, that's how venlafaxine has differentiated itself from SSRI, is that at high dose, venlafaxine will cause hypertension. Now, this vascular effect may be short-lived, but in some other cases, venlafaxine may induce sustained hypertension. Because of this, it's important to monitor your patient's blood pressure. Monitor blood pressure. So, when your patients are on venlafaxine, remember to monitor their blood pressure, because venlafaxine at high doses, at a higher dose, will cause hypertension. In some cases, the hypertension could be short-lived, or in some other cases, it may be sustained. So, as a provider, keep on monitoring blood pressure. Then let's look at another common serotonin-norepinephrine reuptake inhibitor medication, and we are calling this duloxetine. Duloxetine. It's also called Cymbalta. Now, duloxetine, unlike Effexor, that will have an effect on norepinephrine when it hits a higher dose, that's not the case with duloxetine. Duloxetine will have an effect on both norepinephrine and serotonin at the same dose. Now, apart from treating depression, duloxetine has another unique feature that you should never forget. This feature has to do with treatment of chronic pain. So apart from treating depression, duloxetine has a unique feature, and this is with chronic pain. The chronic pain here, we are talking about neuropathic, and fibromyalgia. So we are saying that duloxetine has a unique feature can treat chronic pain, especially neuropathic pain and fibromyalgia. So if your patient is presenting, if your patient has neuropathic pain or he has fibromyalgia and he also has depression, then your choice will be fluoxetine. Okay, your choice will be fluoxetine. Thank you for joining me, and hope to see you in my next class, where I'll be talking about another class of antidepressant called tricyclic antidepressants, TCA. Join me in my next class. Until then, goodbye.